Dr. Mokdad is very well-known personality. He has been over the last several months on national television every day. He is the Chief Strategy Officer for Population Health.
And what we are seeing right now in the United States is we have peaked and we are coming down. That's all United States. On our web, you could have the same graph that I'm showing here for every state. And what you can see here that sometimes at the end of August, early September, you'll see another peak coming up when people are talking about the second wave. And that's mainly due to increased mobility right now, but also COVID-19 is a seasonal virus. We see a strong correlation between COVID-19 and seasonality for pneumonia. And of course, as you can see from this graph as well, that even we are increasing our testing right now, which is the blue line, and our infections are coming down the dashed line, and the lower line is the reported cases on a daily basis. For example, here in the United States, you could see again, you will see a peak again in August where the cases, estimated cases will increase. But we have all our staff in the medical school and our hospital are protected, whatever their job is, when they do their job so they don't get an infection. Are we protecting the vulnerable population and the minorities who are doing an essential job for the country? No, we are not doing a good job. So that's what I mean by racism is more dangerous on our country in terms of public health than a COVID-19 that we will deal with shortly in a vaccine. You know, for those of you who have traveled to Japan, Japanese have a culture of wearing gloves and masks before even COVID-19. And they have a practice of social distancing even before COVID-19. The way they greet themselves by bowing, you have to be away from each other. I'm an Arab, we greet ourselves by kissing each other three times. So, I mean, you have a cultural effect that Japanese are more part of their daily practice. They practice safe distancing and they are aware of wearing a mask, and they wear a mask much more than anybody else. Plus, mobility in Japan went down faster than anywhere else. So Japanese stayed at home as much as they can. That explains a lot of the things that we see between Japan and other countries of the same size, or Tokyo compared to New York or other cities. So the vaccine, I mean, there are several components of your question. One of it is COVID-19 in the fall will come around with the flu season. And we have to be very careful because sometimes even with flu, when the vaccination is very low, and sometimes the vaccine is not as effective as it should, because for flu, we take the strains that were running the past 1 year or 2 years and we redo the vaccine for them, and we take what's been circulating in Asia and do it here. So sometimes we miss the virus is mutating and then we miss that. So we have to be very careful at this season. We have to take, all of us, our flu vaccine more than ever before. That's one. The second one, how confident I am about a vaccine for COVID-19. Very optimistic. I know there are 10 of these drugs, 1 in Oxford, 5 in China, and 4 in the United States that are in phase 2 right now. And I'm aware in China, even in England and here in the US, that what happened there in Sweden is after all the high mortality, and by the way, their mortality rate is number 4 or 5 right now. So it's very high and much higher than their neighbors. And then when the studies that are doing antibodies, immunity in Sweden is about 7 or 8%. So all this death that has happened, immunity is still 7%. This is far short from a herd immunity.